More than half of women who menstruate have one pain or the other, sometimes for either the first or the second day. But some go through severe pain, and the question is, why is it so? Today we'll find out more in our discussion with Time with your Gynae after this break. Welcome back. My name is Patricia Roxanne Hammond, and the show is Time with your Gynae. Our Gynae today is Dr. Promise Sefogah. He's a consultant obstetrician gynecologist with Shape Healthcare Medical Center. He's also a lecturer at the University of Ghana Medical School at the Department of Obs and Gynae. Welcome, Doc.
Thank you, Madam Patricia.
Today we'll be talking about menstruation, and he's going to give us all the answers we need. Can you please educate us on menstruation?
Good. So yes, menstruation is a normal part of the woman's reproductive life. And what brings about menstruation? When a woman is born, from the time of birth till about puberty, her reproductive system is just setting up to start menstruating. At the time of puberty, the woman begins to release an egg under the influence of hormones from the brain. The hormones tell the ovaries to develop an egg and release. The purpose is the egg is supposed to be released and then to get fertilized to form pregnancy. But if that did not happen, the preparation that the womb has prepared to receive pregnancy has to be shed off. And that is what would flow out at the end of the cycle as the menses. So in a nutshell, what is flowing out is the shedding from the inside of the womb, because the preparation was done in anticipation of a pregnancy. Pregnancy did not happen, so we menstruate. So every month the woman menstruates, and for us it is normal if the woman menstruates every 28 days, 30 days, 31, 32 days, some maybe even every 21, 22, 23. That is normal.
So what happens when someone who is supposed to go through this monthly cycle happens to have hers after 3 months, once after 3 months, or once after 6 months?
Yeah.
What happens? What causes that?
Or not at all in a year. So that is a common menstrual disorder.
Okay.
So once the woman is seeing less than 12 to 9, or less than 9 to 12, it means there's a problem. It could mean in a large majority of cases that that woman is not ovulating. Okay? So some of the months she doesn't ovulate, and so the mens wouldn't flow. And there's a condition we call polycystic ovarian syndrome, which is a hormonal problem whereby the monthly hormonal changes that will cause the egg to be released, that doesn't happen. And as a result, there is no preparation here and there's no shedding off. So it takes about 2 or 3 months, then she may bleed by herself. And those people, some of them also have difficulty conceiving for the same reason. Now, it's a disorder that a woman is born with through no fault of theirs.
Is it genetic?
It's genetic in a large extent. And then that woman is also typically going to have a lot of acne, pimples. And they tend to also have some male features. Like they have beard, they have a moustache, they have facial hair, hair on the chest, hair on the tummy, hairy arms, hairy legs. And then that goes with that hormonal problem. But it's something that once it's detected and it's causing that can be handled medically. It's not a big deal.
Okay. So what actually causes the pain?
So menstrual pain, like you said, is that common. If you take 10 women, 6 or so of them would say they do experience menstrual pain, but the severity would differ. Now, there are numerous causes of menstrual pain. And like you said, some of the pains are just mild and may not require any medication. Some are moderate, will require something like paracetamol. Others are so bad, the woman is hardly able to do anything for the 3, 4, 5, 6 days of the menstrual flow. And some would actually require hospitalization to be dealt with. So the causes can range from just simple things like infection in the pelvis, what we call pelvic inflammatory disease. It's a common cause of menstrual pain. Apart from that, there's also in our environment uterine fibroids.
Okay.
Right? And we'll be talking about fibroids in some detail later on, but the fibroids can affect different parts of the womb. So some of the fibroids would affect the inside of the womb. Some would be within the wall of the womb. So the fibroids that are particularly located towards the inside of the womb tend to be the culprits when it comes to severe menstrual pain.
Okay.
Okay. These same fibroids are the ones that will make the woman to bleed excessively, heavy bleeding with clots. And these same fibroids are also responsible for the woman who has her period and it's not yet time for the next period and she's bleeding in between, what we call intermenstrual bleeding. Right? And of course, the fibroid will make it difficult to conceive. So the fibroids are also a leading cause of painful menstruation.
So can I say that every painful menstruation is as a result of the pelvic inflammatory disease and the fibroids? No.
Other conditions would cause that. Another condition which is quite debilitating is called endometriosis.
Okay.
You want to say that after me?
Endometriosis.
Correct. So in endometriosis, the cells that are supposed to be located inside the uterus, what we call the endometrium, the type of cells that are supposed to be there, appear outside the uterus. So these are the cells that are supposed to be inside the lining of the uterus.
Okay.
Okay. That's called endometrial cells, right? And for some reason, some of those cells have found themselves outside the uterus, on the tubes, on the ovaries, and all over.
Why is it so?
It is so because something went wrong. It is a change that happens along wherever they happen, or some people say it is because the blood flow backwards and some of the cells get carried there. There are so many theories to explain it.
Okay.
Right? And so when that has happened, anytime the woman is bleeding from here during the menses, she's also bleeding from all these places. And so this blood collects in the woman's lower abdomen and the blood irritates the tissues and that causes a lot of pain, in addition to bloating, pain when they go to the toilet and other stuff like that. And that can be quite debilitating. And that's
so looking at this, I'm not
endometriosis.
sure over-the-counter painkillers will treat this.
No, you need more than that. Okay, so we have the pelvic infection, we have fibroids, we have endometriosis, and sometimes the wall of the womb, the uterus, is just a bit irritable, so it cramps. And other times, instead of the cells coming all the way to the outside of the womb, the cells, instead of being inside, get to enter the muscle of the womb. So instead of being in here, they are not in there alone. Some have gone inside the wall, and that is called adenomyosis. And you can imagine each time the woman is bleeding during the menses, some of the blood is entering in the wall of the womb. And that also is very painful.
And how can that be corrected?
Medically.
Surgery, is surgery an option?
Some form of surgery for the endometriosis, but medications would also help. In a large majority of cases, medications will be able to take care of that.
Looking at the medications we take when we're going through menstrual pains, is it something that will eventually affect fertility?
Yes, that's a very good question. Some of the medications we take during the menstrual cycle can affect ovulation.
Okay.
Yeah, because sometimes if the medication is taken around the time of ovulation, it actually suppresses ovulation. And some
I
of
know
the
with ovulation too, sometimes you go through a bit of pain.
pain, yes.
Yeah.
So if the ovulation comes with that much pain, and the woman takes a group of drugs we call non-steroidal anti-inflammatory medication, that has a tendency to suppress the ovulation. And so you can't ovulate, so your eggs cannot get released in order to get fertilized for pregnancy to happen. Apart from that, if the cause of the menstrual pain is not detected and dealt with, some of them have the potential of compromising the woman's reproductive capacity.
Wow.
And then other times we use some of the contraceptive medications to deal with the menstrual pain. And of course, so once you are on that to control the pain, be it oral medication or injection, you are not able to conceive as a result of that. But of course, if time is up and you want to conceive, we take you off. And if the conception is not happening, we find other means of helping you to conceive.
There are, okay, let me just give a scenario. I have a friend during the teen years. Anytime she goes through pain, she has to take diclo with para. So 200 milligrams with 800 milligrams of para just to suppress the pain. And when she takes it, she becomes so weak, and she just can't do anything.
Yeah.
And during that time too, she has a loose stool. She's vomiting. What?
Yeah, yeah. So those are some of the symptoms we lump together as a premenstrual syndrome. It's just a result of the hormones that controls the menstruation, and different persons' bodies react to the hormones differently. Somebody will feel bloated, somebody will have mood swings, others will feel weak, others will have loose stools, others will have constipation, the breast will feel engorged and very tender. The woman, some may just not be happy because they don't feel right. It's okay, but the excessive use of these group of drugs is problematic. Because you can imagine if every month the woman is taking diclofenac, it has a tendency to affect the kidneys in the long run. You see, every person is born with two kidneys, one on the left, one on the right. If for some reason, through inappropriate medication, you get your kidneys in trouble, we can't do anything about it. If you are lucky, you may get somebody who donates one of theirs to replace one of your damaged ones. And that's something that hardly we do here, right? In the absence of that, the kidneys have failed, we may have to keep you on dialysis, where a machine does the work of the kidneys for you. Because basically, the kidneys remove waste product from your body. So if the kidneys cannot do that, every week we have to put you in a machine, channel all your blood into that machine to cleanse the blood, and the blood comes back into your system. You have to go into that about 3 times a week for the rest of your life.
So with this, in this case that every month she goes through pain, she has to take the medicine over and over and over again.
Yeah.
Apart from putting the painkillers aside, maybe surgery wouldn't be an option now.
So what it is that it is likely the real cause for her pain has not been figured out. And that is also likely because she may not have sought expert care. Right. Because once you step up to the health facility, we do a thorough assessment, do some blood work, check your hormones, do an ultrasound scan, and we will be able to figure out what the cause of this woman's menstrual pain, which we call dysmenorrhea, is. And then we deal with the underlying cause. And that's how it gets better.
Okay. Before, we'll be going on a break, but before we come back, I want to find out why some people get away with the pain. We'll be right back with more after this break. Welcome back. It's still time with your gynae with Dr. Promise Sefogah. He's a consultant obstetrician gynecologist with SHAPE Healthcare Medical Center at Leta Biokoshi. Now, my next question to the doctor is, why do some people get away with the pain?
Yes, indeed. So like I said, the pain affects different persons with different severities. So for a large majority, just increasing hydration by drinking a lot more of water during the time of the flow, it's okay. Others have other home remedies, like putting a hot water bottle around the belly button area, lower abdomen, and that does it for them. Occasionally, just paracetamol on the first day, and that's okay. And we know that for a large majority as well, if you take paracetamol the day before may be okay to take care of the whole of the cycle, right? But the pain that is persistent and more severe than what we've just described would need to be investigated.
Okay, okay.
And of course, other persons have different pain threshold.
Yeah.
You know, the ability to perceive pain is different for everybody.
Okay.
If somebody pinches you, you may just be okay. Or if you are more like the drama queen, then the little thing, then you jump and giggle, that means you can't stand pain. So that also plays a role in how much pain somebody can withstand as far as menstrual pains are concerned.
Can we dodge this pain and maybe find a remedy to this, apart from menopause that will stop? Is there a way to just stop the flow till further notice?
Yeah, sure, yes. And indeed, that's one of the things we do. For instance, in women with endometriosis,
Yeah.
the pain can be so disturbing. It disrupts life. And you see, the blood we spoke about that bleeds into other parts of the lower abdomen can collect in the ovary and the blood will become a cyst. It's like a little balloon with bleeding inside. So every month the woman is passing some of the blood, some is accumulating there. And over time it forms a cyst with old blood. You know, old blood looks like chocolate.
Yeah.
So we call it a chocolate cyst. And that can be really, really painful. Okay. So what we have to do is find a way of removing that.
And how is that done?
Surgery? Minor surgery. Sometimes we just drain it. Sometimes we do surgery, open surgery, or the keyhole surgery to deal with that. And then, if it's not that bad, there is a place to put the woman on some injection that she will take every month or every 3 months. Some of these will be able to stop the menses, right? Like you said, until further notice. Yeah. And then sometimes we put them on some of these hormonal contraceptive pills in a way that does not allow the regular monthly flows. Okay. We can do that for 3 months, 6 months, or up to a year, depending on severity. And when a woman is ready to now come back and try conceiving, then we go off these medications.
If you're putting the woman on these remedies, going off like no more menses for like a year to 2 to 3, does it not affect fertility?
So it affects fertility just during the period you are on the medication.
Okay.
Yeah. So once we take you off, things come back to normal.
Okay.
Yeah.
So with the brain now sending information to the ovary that it's time for you to release.
Yes.
With this injection, that means it stops.
Yes, it suppresses that. It suppresses the ovulation.
No more blood.
No more blood. So the signaling from the brain to the ovary, we stop it. We use the medicine to tell the brain that there's enough going on, so you don't need to release yours. And so the brain doesn't do that systemic trigger, and the ovary is also quite there, not releasing the egg. And so there is no hormonal influences that will prepare the inside of the womb for the menses to flow, and the woman is pain-free. Up until she's ready to, then we withdraw the medication and the brain resumes. So
with that, will the pain continue? Because now you have taken the solution out.
Yes. So
the pain will resume.
In a large majority, it will resume, but we will do this at a time the woman is probably trying to now get pregnant. Okay. Now, some of the pain of menstrual flow, which is from the endometriosis or adenomyosis, when the woman gets pregnant for the 9 months of pregnancy, the pregnancy itself suppresses the menstrual. Of course, the 9 months there's no flow.
There's no flow, yeah.
So that suppresses it adequately, which is why you may hear some of the old folks say, once you get pregnant and you have a baby, your menstrual pains will go away.
Yeah, that was actually going to be my next question.
Right, so that's how it happens. Because the pregnancy would have suppressed all these endometriotic, adenomyotic tissues. Yeah. And that's how a lot of them get better with time.
Okay. But some people, after birth, they don't have their menses again for like more than a year. I know someone, she went for a whole year without menses.
So after delivery, you know, after we've delivered, either through normal vaginal delivery or cesarean, the inside of the womb continues to bleed, which we call the lochia. That can go for up to 6 weeks, and then it stops. Now, if the woman is doing exclusive breastfeeding, the hormone from the brain that tells the breast to release the milk that hormone also suppresses ovulation.
Okay.
And so the woman will not ovulate and see her menses, which is why that is a form of family planning. We call it lactation amenorrhea method. The woman is lactating, she's not bleeding, so she's safe.
Does that always work?
It works once the woman is doing exclusive breastfeeding and breastfeeding on demand. Anytime baby wants, you give. You don't smuggle in and give a formula in between. Because once you do that, you break the cycle. You may ovulate, and that is where it may fail.
Okay.
But once you're doing it exclusively, it works in a very high majority of cases.
Okay.
Right. So it is that which goes on until the baby starts feeding on other supplementary feed. Then there is ovulation now.
Okay.
And then depending on the woman's body, the hormonal mechanisms would resume at different times for different persons.
Okay.
Which is why somebody's menses may resume 4 months, 3 months, 7 months, 12. It varies from person to person.
So away from pregnancy and lactating, what causes this regular and irregular menses? You know, some people will be late. They're expecting it on the 21st and it comes on the 30th.
Right.
And then with that, you have to do pregnancy tests, even if you haven't done anything. But if you've gone beyond, that is when you be a bit anxious.
Yes.
Yeah. So what actually causes that?
Simple things like changing environment. You used to live in Dansoman, you have relocated to East Legon. It could affect it because it affects the brain and how the hormones work. So it takes time to readjust. So, or you're a student, you were on campus, you're on vacation, you've come back home. It changes it. And also stress. Stress would also affect how the hormones work and how your menses would flow. Of course, apart from that, women who take these emergency contraceptive pills, the hormones have the tendency to delay the flow. That's a tricky thing about it. So you had unprotected sexual encounter, you felt you were not safe around the time, you took the hormonal emergency contraceptive pill, hoping to prevent pregnancy. The time is due, the flow hasn't come. You are very anxious. Is it like the thing failed, or is it like I'm pregnant? Or so that happens because the hormones in the emergency pills will delay it a little bit. Once you do the pregnancy test and it's negative, just repeat it, say weekly, and it will come. The flow will come. So,
you know, is there a possibility that you don't have, you don't go through any of these? You're not stressed, you've not changed your environment, you haven't had any sexual encounter, but still it delays?
Or you don't have any severe illness, you haven't gone through major surgery. Yeah, other times, problems regarding the womb itself can cause that. For instance, some people have termination of pregnancy, which is done in a way that it overly scrapes the inside of the womb. And that is a big problem. And we tend to see quite a number of that.
Is it either with the medicine, I think?
No, it's not. That one they use, they do it manually.
Okay.
Right? So they do the procedure to terminate unwanted pregnancy. And they do it overly. They scrape the inside of the womb. And that is a big problem. That womb it heals and the womb is stuck together like that. So there's no space to bleed out. So it's a form of a complication we call Asherman syndrome. And in that woman, there wouldn't be menses again. Other times, the woman is having the menses all right, but there's a blockage in the flow. And that happens in some women who insert herbal preparations in the vagina for various reasons. We've seen others who said they were given the herbs to insert to cure fibroids. And unfortunately, the vagina got damaged and it healed and got stuck. Okay? The medicine wouldn't do anything about the fibroid. The fibroids kept growing bigger. Every month she had the flow, it wouldn't come out. So the blood kept accumulating inside. Right? So eventually we had to do surgery to create the vagina, let off the old blood that has accumulated before later on go do surgery to deal with the fibroid. That is a self-imposed trauma. Right? And others too, it's some form of hormonal problem. Okay. We call it secondary amenorrhea. So it could be from one hormone or the other. Sometimes it could result from excessive weight gain or excessive weight loss.
So it's like whatever you do, it will affect one thing or the other.
Or the other. So that's why the rule is moderation. Moderation. Plus, if any of these changes are happening, you are not able to know what the problem is.
Yeah.
So we always advise seek professional care.
Does the womb has its own way of recovering? Like it restores itself?
Oh,
or
yes.
heals itself?
Yes, it does. Which is why, you know, one menstrual flow has ended, the inside has started getting ready for the next one.
I'm asking in regards to the earlier question you answered, where the womb, due to unsafe abortion, it's totally damaged. So I want to find out, does it heal itself?
So the healing is, you see, the inside lining of the womb is a different type of cell. Okay, so here, the inside lining here is different from here.
Okay.
Right? So that scraping scrapes off this. This is a smooth, soft part. It's scraped all off. And it's just exposed this place, which is more like meaty part. Okay? So the meaty part gets stuck with another meaty part. And it's just like a scar formation when you have a cut. So the scar has formed and the two parts have come together. They are stuck. That womb is damaged for good.
There is no medical procedure that can correct it?
The procedures hardly work. And so for that woman, if she is not yet have children, we have to take her eggs, use her partner's sperm to fertilize the eggs, and get somebody to carry that pregnancy for us.
That's a topic for another day. It's been an interesting conversation, Doug. I'm so glad you give us this opportunity to have this education on menstruation. The program is Time with Your Gynae, and my guest has been Dr. Promise Sefogah. He's a consultant obstetrician gynecologist. He's also a lecturer at the Ghana Medical School at the Obs and Gynae Department. He is stationed at Shape Healthcare Medical Center at Latibiokoshi. If you have more questions, you can reach Doctor on 0302 631 880. 0302 631 880. Doctor is with the Shape Medical Healthcare Center at Latibiokoshi. My name is Patricia Roxanne Hammond, and the show has been Time with Your Gynae. Thanks for watching.